Hello, how are you? My name is Shelby Christensen, and I am a alumni of St. John Fisher College, and I will be talking to you about my experience with Cushing's disease. So the first thing that I'm going to talk about is how I was actually diagnosed. Prior to going to Fredonia State, which is where I originally went to college, I had to do, a normal checkup, freshman checkup thing that you always have to do. So at that point in time, I had gained about 10 pounds from where I weighed at the beginning January of the year. And I also had, my period had disappeared, so I did not have that either. I had gone to my pediatrician for the checkup, and he informed me that it just seemed like a normal growth spurt. I've always been super, super small, so he just thought that I was kind of hitting that upwards slope and it wasn't really anything to worry about. I had gone to the gynecologist also before going to school as a checkup, and she also informed me that it could be because of the weight gain that my period had disappeared, so not really to worry about it. I went off to college thinking that everything was pretty cool, no big deal. I do want to mention that at this point, which was about June or July of 2009, I had three different friends of mine on three separate occasions come up to me and ask me if I were on steroids. So that is something to take note of. It's actually two out of those three friends of mine that asked me that question are now currently nurses. So I just think that's really, really funny. And in my opinion, they're pretty damn good nurses. So the next time I went home, which was fall break, they noticed that something was majorly wrong. I didn't, of course, because I'm very naive and you don't really notice it when it's happening to yourself. I went back to school and they contacted a nurse friend who was an RN and a friend of the family. And they had relayed some symptoms that I was feeling, or just regular emotions that I was having to her. To which she came back with the response that, it sounds like that she could have Cushing's. So in that initial appointment that I had, my parents asked if I could be tested. And he said, I don't think so. I think we should go down a different avenue. I was recommended to get tested for polycystic ovarian syndrome, in which I did. I had an ultrasound, which came back negative, and then I had a second meeting with him, and with some little twisting of the arm from my father, he decided to at least let me do the initial test of Cushing's, which was the 24-hour urine test. I had done that, and the results, my cortisol level results, came back a bit abnormal. So then he allowed me to do the secondary testing, which was the saliva test. And those results were absolutely through the roof. They were ridiculous. It was a little bit of validation that it's okay to listen to your gut and to listen to other people. And it's okay to be really proactive. And nobody knows what you're feeling more than you and the closest people around you. And that's one of the things that I learned through this whole process. From that point on, things went very, very smoothly and extremely quickly. I was put in the best care from a team of doctors from Strong, and they are amazing. And the first thing that my endocrinologist said when I walked into the room and met him was that he goes, Shelby, you are the poster child for Cushing's. And that was a shock. Surprising. Scary. So moving on, how my disease was treated. Technically, it was treated by a transfenodal something. I don't know the technical term. What they did physically was they went up through my nose with little tools and a microscope, I assume, and they scraped out as much of the tumor that they could find. The tumor actually was located on my pituitary gland, which I'm sure you know this, but it's right behind my optic nerve. After the surgery, my disease was treated with heavy amounts of medication and drugs. which were very clutch. I was on Vicodin for, I would say, every day for about 3 months or so. And I was on steroids, multiple different kinds, I think, hydrocortisone and prednisone for a while. All in all, maybe 9 months or so, along with surgery and drugs. I did a heavy amount of physical therapy for about 8 or 9 months. I went every other day. Everything from, working towards lifting a 5 pound weight 10 times above my shoulders to trying to walk 10 minutes on the treadmill without having to stop. How did I feel during all the different stages of the illness? And the answer is awful. Every stage was awful in their own different, very, very different ways. So prior to recognizing all the symptoms that was going on, what I was actually feeling was just confused. I really didn't know what was happening or why it was happening. So I thought, oh, I was just growing. I was turning into a woman. This is what college is like. You just gain a ton of weight, whatever. But I'm going to read off a list of some of the symptoms that I had. I told you, I'd mentioned earlier that I lost my period first. That was the first symptom to go. Getting up to go to the bathroom in the middle of the night was something that I never used to do, and that was a weird symptom. You will see, I'll show pictures in a little bit, but I had the most awful moon face. I had the weight gain, obviously. I gained 40 pounds altogether, but the bulk of it was about 30 pounds in 2 to 3 months, which was a ton. I had facial hair, not like heavy beards, but I did have hair that grew more than normal on my face, but yet I was losing a ton of hair on the top of my head. All the weight that I did gain ended up in my stomach. I developed stria marks, which are like the stretch marks. I'm sure you know that. Fatigue was probably one of the worst symptoms. I love to sleep normally, so I didn't think it was a big deal that I would just come home from everything and go to sleep until my roommate recognized that I was sleeping about 16 hours a day, and she's like, this is a little weird. I had awful mood swings. I did develop type 2 diabetes at the time. I lost basically all of my muscle mass. There were multiple times that semester in Fredonia that I lived on the second floor and I would use the stairs, and I fell countless times. By the end of the year, I was crawling up the stairs to get to my dorm room, and I would wait until my roommate was already up and she's closed the door so that she wouldn't see me as I crawled up the stairs, because that was humiliating. One of the worst symptoms, I think, in my opinion, was the backache. Because of the amount of weight that I was carrying around my stomach, my back was on fire. I don't know if that's what it's like to carry a child. I related to that, though I don't have experience, so I can't do that, but I do, because I would imagine it's similar, but it's very painful. Of all of these symptoms, the worst is the mind. And that's something that you really, as a patient, I think you really, from my experience anyway, you struggle with more after surgery. I currently mentor others who have or who are going through Cushing's, and I am very honest, and I tell them that the hard part really doesn't begin until after you've had the surgery, because that's when all the questions come up. It's a false hope type of feeling, because you're like, yes, the tumor is out, things should be going back to normal and everything's going to go in reverse. And it's just not that simple. And so that's when you really struggle with the mind. It's not all bad though. It's not. If you get to the point where you have weaned yourself off the steroids and you no longer have to take them, it is the most amazing feeling in the world. And you just are so motivated. And the great thing is you honestly don't have to do, well, in my experience anyway, I can't speak for others, but I didn't have to do that much work. When I was able to get off of my steroids, all of the symptoms reversed within 3 months. I lost the 40 pounds in 3 months, and I wasn't even doing anything. It literally fell off of me. Like, fell off of me. It is crazy. But that feeling is just, it's incredible. So throughout this whole process, I've had two really impactful nursing experiences. The first one was right after I had had my surgery. I had a nurse, and I really wish I had remembered her name. I know she was the day nurse. I do remember her respectfulness towards me and the sympathy that was given, which I think is just a simple thing. But in that instance, for me, I was so insecure and so vulnerable and scared, just to have somebody who takes the time to call you by name and to just ask you normal questions and to just be very caring. It was something that I remember very vividly. The reason why I do remember the way she acted towards me so well was because the night nurse that I had right after her was the complete opposite of her treatment and her way about this, kind of how she went about things. I will never forget when she had come in and she was giving me the heparin shot, which is not fun to begin with, but the shot was so aggressively done. And, it's something where you can't sleep in a hospital anyway, and, you're in pain, and it's just not a fun experience. And then to be woken up out of a light sleep so aggressively and to then just get a heparin shot just kind of chucked in your stomach. It was painful and not a good experience. And this lady, I'm pretty sure did not care at all about me or about how I felt, and that's how I felt anyway. And she may have, but it just kind of what I perceived. And after that night, I had the option from the hospital to stay another night or to leave. And because of that night nurse, I left. Okay, so now I'm going to show you some quick pictures. This first picture is from April of 2009. This was 2 months after that first picture I just showed. The next picture after this is from August of 2009. I actually don't have too many pictures in between then and surgery, but there is one picture. The next picture is from January 2010. And this next picture is 4 months from the one I just showed, so it was in the summer of 2010, July. This last picture is a one full calendar year from my surgery date. So the last thing I am to talk about is how long it took for me to recover completely from this disease. Just now am I starting to feel like how I used to and feeling really, really good and really, really healthy and not worried so much about fracturing something. Unfortunately, my 5-year checkup did not go as planned. It's been, I guess, determined, as much as we know, that I am in the beginning stages of the disease yet again. At the moment, I am on cabergoline. You'll probably know more about it than I do. If it does not work, which I will know within a month or two, I will have to go on to some further options. It's it it's 90% mental in my mind, and you have to stay positive, and I feel great. I feel the best I have in 5 years. And so that's kind of what I'm going off of. At this point, I don't really have any more to say, and you're probably bored of hearing me speak. I want to thank the nursing department and your professors for letting me speak. I want to thank you. If you have any questions, feel free. I'll put my email down in that thing, and you can email me about anything. I live in Chicago. If you want to visit, come visit. It's fine. Whatever. Thanks. Good luck on your final. And